It is important to have an effective date. As again, Dr. Nicola has highlighted, information keeps changing or it keeps being enhanced, so it's good to be at par. The review date obviously will be after the duration. For example, on 15th of March, review date in this case after 2 years will be 14th of March 2026, 2 years after 2024. So the contents of the footer basically is the designation, person who prepared the SOP. So you just put in the name, the signature, the date the SOP took effect, that is the date the SOP was signed, the county logo, or both county and country logo, permanent ink. So by the time you come to revise your SOP, in this case, after the 2 years, if you are to use 14th of March 2026, so you use department shall prepare a draft SOP. Example, first you start with the draft, then you circulate it to responsible persons for review and recommendation. This is key for departmental inclusivity, have everyone on board. So you circulate it and get recommendations and review from responsible persons. Review the draft SOP and you submit it for approval and final authorization. Once approved, you change the logo or you customize it. Once you have the authorization, once the authorization is through, the department head shall make 2 copies, stamp and do not photocopy in red ink, and distribute it to the relevant personnel or relevant areas for display. The remaining copy will be stamped master in green, and all copies must be signed in the SOP distribution register. I hope we are together until then. Tuko pamoja. So moving on to references, you just cite what you use as reference. This, in case of it being a revision, obviously the first version will be the key reference, and then you build up on that. So for annexures, again, you list down what you had, and if in case you didn't have any, you just cite that applicable. Then abbreviation, you use what you had. Okay? So in this case, we basically use the simple versions for knowledge communication or knowledge passing. So for the CDH is the Country Director of Health, EPA, SOP, and centimeters. So moving on, I'd promised to project a sample SOP outlook. This is basically what it looks like. Okay, so you can see the header and the footer. Then the objective, the scope, responsibility, accountability, tools, procedure, annex, abbreviations. So you just build on this standard tool. So please write down your questions, if any, on the side, on the chat box. We will get back to them. We will address them as soon as we can. So this concludes the SOP on writing SOPs, basically. So if you are to move on, it is important to showcase the commodity management tools. We'll go through them here. So once we start the other SOPs, you'll just reference or recollect what I had taken you through. So the first one is BinCard. This is a standard tool. This is what you use to record your commodities. Let's say Panadol. Let's use the example of Panadol. So item description will be paracetamol 500 mg, paracetamol suspension or paracetamol IV. The unit of issue, it's very clear. The expiry dates, it is important to note for ease of follow-up so things don't expire on us. So you start with the date, the reference number, receipts, issues, balances, name of issuing officers, name of issuing or receiving officer. So the reference number for us, if we're using commodities from KEMSA, we normally tend to use the delivery note number. That's what you key in for ease of reference. So this is a 2-part BinCard. If you see, these are 2 halves in 1 page. So you just continue. It's actually 4-part if you see, 2 on top, 2 at the bottom. Then at the bottom, you have to, there's a balance carried forward in case it's a second it's a second bin card or a follow-up bin card, you have to do that. And if it's a follow-up bin card, the next one you have to start with the balances. In case the initial bin card was filled up, for the second one or the one after, you'll have to include the previous bin card number and the balances that you're carrying forward with from that bin card. So moving on, this is also a basic tool for commodity management and S11, counter requisition and issue voucher. Why tunajua S11 and we don't know the other term, counter requisition and issue voucher, that looks like this. So there's the ministry, department or branch, the unit, the issue point if it is the main store, point of use if it is pharmacy, it is lab. So this we mainly use from the main store to the subsidiaries or from one facility to another. So you just write down the code number, the item you are issuing, unit of issue, the quantity you are issuing or the quantity that has been requested, and what you actually issued is not always, they don't always correlate. So you just specify what was requested against what you issued and remarks if you have anything to add. So at the bottom, there'll be the officer who requisitioned, they'll sign with their designation and signature. The officer who is issuing will sign with their name, signature, and the date, followed by the receiving officer. So 3 signatories at the bottom of the S11. Next is the counter S13. This is the receipt voucher. What you use to note down what did. So someone is talking. Dr. Nico, are you back?
No, it's someone who unmuted. I've just muted them. Can continue.
Thanks, Doc. So for the S13, this is basically how it looks like. So you have to indicate the item you have received, the source, just fill it as it's been specified. So the item, the units, the quantity, the remarks, or the value. For value, it's just easy to pick from the delivery note. Okay. So again, you have to countersign it has to be countersigned by the issuing officer, by the receiving officer, for all this for transparency and accountability. So moving on, this is a temperature monitoring log. Basically, you just write the time you've taken the temperature you've noted. You have to be clear if it's acceptable or not. Those that are not, there are some things we need to do mostly is make sure if it is a fridge that's non-functional, it's back to full or proper service. Then the initials of the person recording the temperature, and again repeated in the evening of the same day. So we record the temperature twice in a day, morning and evening. Moving on, this is an expiry tracking chart. So the wording on top appears a bit small, but these are just months. So you write down the commodity. It's important to track all to avoid expiry. So you write down the commodity. And for those who tend to recycle or to reuse an expiry tracking chart, you use stick-ons, because once you write on them, they are basically wasted. So a stick-on is a simple way to ensure you can reuse the chart. So you can tabulate for a year or 2. This is basically a 3-year chart for January to December into 3 sections. So you have an option of tracking one commodity across 3 years or less, dependent on the shelf life left by the time you actually get the commodity. So this will help you reduce any expiries on commodities expiring on you. So it will give you a good heads up on when you know when you need to redistribute. So this is what an expiry tracking chart looks like. F458, form for disposal of expired and obsolete commodities. So you fill this when you actually have expired drugs within the facility that ideally we should not be having, but somehow happens for one reason or another. So you just note down the facility name and county. So in this case, it's Mombasa, one of the 6 sub-counties, and the level of the facility. Then you indicate the name, the batch number, the date of manufacture, expiry date, all this available on the pack of the commodity. Then you tabulate the quantity plus the cost, and you have to explain the reason for expiry. I think this will put some of us to task of proposed disposal method and remarks. So this is a standard form you fill for all expired and obsolete items. The form name is an FO58. So moving on now to take you through a few SOPs. I'd spoken when we first started, I'd explained that the content is a bit huge for this, for the SOP, so we'll not be able to do the entire cycle today, but we'll do what we can. So we're moving on to selection and quantification of health products and technologies. Dr. Nico, feel free to raise your hand so I know you're back. So moving on, the header is standard. So you've seen the number, the edition, the county, SOP for selection of health products and technologies. It tells us that there are 2 pages in each SOP. So at a glance, if you see one page, you should be able to tell that another is missing. So the purpose, basically, is to detail the process of selection of health products and technologies in health facilities. So for our scope will be all health facilities within the county. Then it's listed down the responsible person, as you can see. So the accountability, since it's for all levels of facility levels within the county, all the in-charges have been listed down, and procurement officer is included as well. So the resources we need in this preparation is the drug list, the county formulary, the requisition form, procurement plan, and the list of pre-qualified suppliers. Very important, pre-qualified suppliers. We tend for the county facilities to lean to KEMSA because that is what is standard. But for whatever is not supplied within KEMSA, we lean toward meds and all other pre-qualified suppliers. So let's remember to contain ourselves within that, mostly for the GOK or county facilities. So the procedure, the hospital prepares a list of what they want. The drug list, the KML, and all that will be the key resources when you're making the decision of which drug to have in stock in the facility. So you compile what you need. Basically, you compile requisition form based on quantification of procurement plan, submit to procurement department. Basically, you just have to quantify based on previous consumption history to have an actual number of need of the commodities you want to order for. So the procurement department in this case will float quotations to pre-qualified suppliers every quarter for those that are not available at KEMSA for county facilities. So for pre-qualified suppliers, they'll be expected to return the filled and signed quotation within 7 days. The procurement officer and user departments, whether it's pharmacy, it's lab, or whichever other department, as well as the chair of the opening committee in charge, will open the quotation and sign as witnesses. Then the user department conducting analysis of the quotations and makes orders based on the lowest quoted price. So the lowest price and best quality product becomes the winner of that floated tender. So the evaluation committee will then verify the analysis and quotation to ensure all products have been observed and the orders proceed. This marks the end of this SOP, or this standard operating procedure. So moving on to the next, quantification. As that's spoken, you order what you have quantified based on previous consumption, is how I'd simply define it, but let's go through this SOPs so we know exactly what is expected of us. So for the purpose, since we are doing quantification, so to detail the process of quantification of health products and technologies in health facilities using the consumption. Health products and technologies are not limited to pharmaceuticals only. All commodities within the facility falls under this same bracket. So the scope will be all health facilities of all levels, responsible being the pharmaceutical technology, pharmacies, pharmaceutical designation, or whichever healthcare provider that will spearhead the quantification exercise. Accountability